Hi everyone, this is the Enchantress, the Good Samaritan out here on these YouTube streets. How's it going today? I'm a little breathy, guys. I just finished doing my little run. But I wanted to come and share something with you. Now for about 4 or 5 months, I've really been focusing on this transgender medical awareness that's spreading within the United States. And so if you were to go on these YouTube streets, you would find a plethora of videos that will reveal to you how to determine if an individual is transgendered. And a lot of times there are entertainers that are outed. And so because of my interest in these videos and into the subject itself, I began to watch these videos. And I noticed that in every video that there was an exposure, I would use what I had gathered as ways to observe an individual's skeletal system and to take those pieces of information and data that I've collected along the way and to determine if I could tell whether they were transgendered or perhaps intersex. I'm interested in intersex as well, but my bigger focus is on those that are transgendered, these adults, and the children in reference to, them being given a voice by some adult based on what an adult's agenda is. So, along the way, I've seen people say that you determine by the length of the hand, where it meets the pubic area, the curvature in the back that a woman has to allow her cervix to descend forward to be able to carry a child, brow ridges, skull sizes, what else? Even the manner in which a male walks, his gait, which puts most of his pressure in the back of his gait because he doesn't have to accommodate or shift for that pelvic area that has to have room to descend when carrying a child. With a woman, her foot is put forward. And so those little things are used to determine whether or not these people are transgender. And upon investigating and starting to watch these videos, I've noticed that there is a huge number of entertainers or public figures who appear to be transgendered. And any responsibility that I have, I try to take not just one test area or test subjects. I try to take a couple and, just compare them, side by side. Okay, if this is the case, there's a huge number of transgenders in public eye. That would be sports, entertainment, politics. You can go on and on. In order for the numbers to be ones that are not appearing to be induced by large numbers, you would take a test area, a test subjects in your own personal life. So the responsible investigator would take their personal life and they would begin to document, observe, and put to test the number of individuals that they run into on a regular basis and keep a tally to see how many of those appear to be transgendered. Once you get these skill sets to be able to investigate, then you can take it and you can do a personal investigation in your own personal life. And so I did that. And I noticed that those numbers in my personal life and those that I was being exposed to, the ratio of transgenders being revealed through investigation was far less percentage-wise than what I was seeing on TV. So common sense will let me know that these public figures and these entertainers in politics and in media, these numbers are being induced or purposely augmented. And so because of that, and months of investigation, I wanted to find out why. And that why has led me to explore things that gave me a greater understanding. Okay, I know that this transgender thing is not something new. It cannot be. It just can't be, because when I study history, it goes back as far as maybe 200 or 300 years that I'm aware of, as far as the medical aspect of it, where you can see that a lot of science and medicine was put into the topic. Yeah, so I could say 200 to 300 years, or even greater. But I don't want to go too far, so let's just keep it average 200 years. But there has been a huge influx in the United States, and I wanted to have an understanding as to why. So when I began to dig and investigate, I had to know I had to take an ideal time frame that would be conducive to me getting the best return in my investigation, collecting the data, observation, and just, test studies. Personally, I had to narrow the time frame down, and I did, and I decided to take it based on the information and data that I collected from 1970 until now. So in doing that, I went back and I found the three, what is considered in the medical field as the three musketeers of this transgender medicine. And the three musketeers are as such: Dr. Norman Spack, Harry Benjamin, and John Money. Now, while they term Three Musketeers, I would have to say it's because they are the three that really got this movement in medicine rolling to a point that it became pretty widespread. Now, my focus during this video is going to be on John Money. My energy and my spirit has focused on him for the last few days. And following my unction and discerning what it is that it wanted me to gather is, once again, 100%. John Money is and was a character. And I'm putting that very politely. What I will do now is I will give you a little background on him, okay? He was a psychologist in the mid to, 1960s. Okay, John Money encouraged the gender reassignment of one particular male named David Raymer. He was born a biological male, but suffered irreparable damage to his penis as an infant. Now I want to stop right there. I've had this theory after starting to investigate transgender medicine that male babies who were going to be circumcised, based on what I believe, is that they were purposely being, castrated. Not accidents, on purpose. And so I always wondered about how can you accidentally castrate a newborn infant if circumcision is a big part of your medical procedures that take place in your neonatal units in all hospitals. Okay, we have to throw in the possibility for error. Maybe a child's more physically active and there is some type of movement, and you got these external circumstances and whatever. To me, that's kind of far-fetched, but we have to use common sense and say that this is a possibility that this could have happened. Now, if this does happen to a child, I'm sure that there are going to be guidelines and procedures and different implements to keep that from happening again. If that does happen one time, there shouldn't be an increase in numbers across the board in the United States where this is happening. Because if it happens at one hospital, there's going to be a sharing of this information to other hospitals, and it's going to spread. And so because of this horrible thing that has happened to this infant, doctors in hospitals would want to be in a position of not found negligent. So this by common sense, because you want to keep the integrity of your practicing, you would want to put in these guidelines and implements so that you won't have these incidents happening. So based on my common sense, I understand that these castrations should not be on a rise. If there is a rise in infant castration while circumcised, to me that has to be sort of an agenda. That's just common sense for me. So anyway, there was a situation where this child, male child, David Reimer, was born, and he was accidentally, or not purposely, that they say, castrated because it was a failed circumcision. After encouragement for money, the child's parents decided to raise Reimer as a girl. So the infant underwent surgery as an infant to construct rudimentary female genitalia and was given female hormones, during puberty. So this child was followed from infancy up to puberty. So that is what, 13, from 12 to, say, sometimes 11, from infancy to 11 years, this child was under the care of a physician. And we see that John Money was the spearhead of this medical treatment for this child, that when he hit puberty, he was given female hormones. All right. And the child was never told he was biologically male and regularly visited Money. See, this is confirmation. Money tracked the progress of his gender reassignment. The child, Reimer, unknowingly acted as an experimental subject in Money's controversial investigation, which he called the John/Joan case. The case provided results that were used to justify thousands of sex reassignment surgery for cases of children with reproductive abnormalities. Despite his upbringing, Reimer rejected the female identity as a young teenager and began living as a male. He suffered severe depression throughout his life, which culminated in his suicide at 38 years of age. Reimer and his public statements about the trauma of his transition brought attention to gender identity and called into question the sex reassignment of infants and children. Okay, that right there is valuable information for me, because it's leading me to believe that these castrations were not accidental. I would have to do more research to be totally confident in that, but based on my spiritual flow and existence, I would say yes. Okay, so we see that this child was a test subject of Money, and for years he was under his medical care and was given hormones to adapt as a female, and he was never told growing up as a small child that he was born a male. So he had these huge emotional and psychological issues that eventually resulted in him understanding that he was a male and that he had been, castrated. And so they say he eventually killed himself. And now I can understand how it would lead up to that point, where they would, feel as if they didn't want to live. Now, this brings me to Money as an individual. Now, they say he died in his 80s in 2003, between 2003 and 2006, of Parkinson's disease. I'm not surprised, because unsuspecting young children